Okay, so now we've done the right side, and I've actually just off camera done the left side as well to correct this, and you can see a beautiful, nice inflated sort of mid face here, the cheek area, both sides, and a little zygomatic arch here, which I've also filled to give that nice sort of uplift, and it really has softened the nasolabial folds already, as you can see, and it's a very nice effect. No bruising there, very comfortable, very straightforward to do. Again, emphasis, make sure that you know the anatomy, exactly where you're injecting, and your needle section is correct, and a little bit of massaging in this here just to mold it into place, but really don't need very much massaging. Hello, Amrish Patel. I'm now going to demonstrate filling of the lower face, the lower third of the face. This is Nadine, who we've already sort of discussed what we're going to do. She's outlined what she prefers. We've given her some anesthetic, a mental block, and also some topical anesthetic, and she is numb now and she's comfortable. So her main priority, what she wants doing, is the marionette lines here and here. We've already done the cheeks and lifted the zygomatic arch. It's quite deep line, more so on the right rather than the left. And it's always important to remember there is inherent asymmetry. You cannot do exactly the both on each side. You have to sort of individualize your treatment to the patient and put a little bit more filler on the side which is more desirable. She's got a little hollow there which she's very aware of, and we'll fill that up. But also she's got the pre-sulcus jowls here on an angle. You'll see there's a dip in there, and sort of the bulk, the curve here, and we're just trying to straighten this out. Aesthetically, it's very pleasing. Okay, so the first place we'll inject is the marionette line here, the hollow here, and needle selection is very important here. Again, I prefer, as an injector, you'll get your own preferences. This will be a shorter needle, 28 gauge, and I usually use the fanning technique. There's many techniques we can use. You can bonuses in this. There's serial threading, there's linear threading, and there's a fanning technique here. So I'm going to insert the needle into the subdermal plane, and then gently inject. And as I do so, you'll see there, and this is the fanning. You'll see that being lifted. As you can see, there's a slight asymmetry. Just mold it slightly, and again, trying pushing the tissue up. And it's really important that you inject in the whole area here. Try and create a support support the whole tissue. I have an ultrasound jelly here, and I'm just going to gently massage it just so that we get this all in here. And you know, when you massage, you feel that it's really the mid face dropping down here, which is creating this sulcus here. And the more we lift here, the less fillers we have to do in this zone here. And there's been some correction here. She needs a little bit more there, but I'm just going to work on the pre-jowl now, and we'll come back to this area. Pre-jowl. This is a much deeper injection, and the needle goes to the periostal surface, and we walk along the periostal surface, correcting this deficit here. And as I do so, massage it very gently, just a little bit in the periostal surface, and in there, along, and then we draw the needle. And as I do so, just mold it a little bit, just to make sure that you know exactly your fill has been delivered where you think it's been delivered. And you can see that nice straight edge here, and it's the sulcus, the jowl defect is corrected completely. I'm going to put a little bit more in her marionette area, which I'll do right now. And again, it's a fan technique here. Okay, massage this. Gently, make sure you don't hurt your patient, because they really don't appreciate that. See, nice straight gel, and this is corrected a lot. And next there'll be a little bit of swelling there. I always have them have their ice pack with us. And can you ice that for me, please, Nadine?